The effect of hypertension medicine on physiological response to exercise. So exercise recommended for the cardiac patient in respect to the effect of beta blocker are limiting the increase in heart rate to protect the heart. So with the heart rate limit in how high it can raise, the RPE is generally used rather than the calculating percentage of maximal heart rate to provide a target heart rate level exercise for exercise purpose. However, if the heart rate limit in how high it can raise, so will that influence the anaerobic threshold and maximal oxygen consumption? So the purpose of the study investigate the influence of cardio-selective beta blocker on the anaerobic threshold and maximal oxygen consumption. So 20 healthy and non-heart disease subjects, including men and women, in kinesiology major in UTA, volunteered to participate in this study. The A high weight was self-report and baseline blood lactate measure were done. Then the maximal exercise protocol were done using the bicycle ergometer. The heart rate monitor was placed around the chest, a blood pressure cuff applied to the upper arm, and seat height adjusted. The workload in cycle ergometer begin with 50 watts and increase by 50 watts every 3 minutes until the subject could not stay longer and then stay above 50 RPM. So the RPE were measured in the end of each 3 minutes along with the measure of blood lactate. 5 minutes after the completion of maximal exercise test, the final blood lactate measure were made, and the subject were randomly assigned to the Visopro, the beta blocker, or the placebo, that's the sugar pill, to consume daily for 2 weeks. So each subject then returned at the end of week number 2 and repeats the testing. For the blood lactate measure, the finger were cleaned with alcohol and then we obtained a drop of blood which were placed for on the margins for reading. For the conclusions, the exercise time to exhaustion and VO2 max were decreased. The maximal heart rate will also decrease, but the anaerobic threshold were not different between the two groups. So the Biopro impair the exercise performance and increase the rating of perceived exertion without altering the blood lactate accumulations.